Hello, this is Akram Jafar, and today we're going to deal with the muscles of the face using the Axis Scientific Plastic Model for the human skull with removable muscles supplied by the Anatomy Warehouse. On the face, there are certain muscles that are on one side attached to bone, and on the other side, they are attached to the skin. And these are the muscles which are called muscles of facial expression, and these muscles are supplied by branches of the facial nerve. They are our main interest today. At the same time, there are other muscles on the face. For example, this muscle here, this is the masseter muscle, and also here there's this muscle which is the temporalis muscle. They are attached on one side, they are attached to bone. For example, here in case of the masseter, it's attached to the zygomatic arch as well as the mandible, and so they move the mandible, and they are called the muscles of mastication as opposed to muscles of facial expression. They are not attached to the skin. These muscles of mastication are supplied by the trigeminal nerve, which, to be specific, it is the mandibular division of the trigeminal nerve. Embryologically speaking, the muscles of facial expression are supplied by the facial nerve because they are derivatives of the second branchial arch, and the facial nerve is the nerve of the second pharyngeal arch, while the muscles of mastication are supplied by the trigeminal nerve because they are derivatives of the first branchial arch. Now let's have some more details about the muscles of facial expression. These muscles are so thin and easily destroyed during dissection because they are just located underneath the skin. That's why a plastic model as accurate as this one would help in studying them. Since these muscles are attached to a relatively thin skin of the face, they move the skin and hence they produce the facial expressions. The muscles of facial expression constitute groups of sphincters and dilators around the orifices and of the face, mainly around the eye and the mouth, but they are also present around the nose and around the ear. These muscles around the nose and the ear, they are not so prominent in humans, and so we are not going to focus on them. The auricular muscles are not present here, muscles that will cause wiggling of the ears in some individuals. So let's start with the group of muscles of facial expression that are present around the orbit. You can see here this muscle with circularly arranged muscle fibers. This is called the Orbicularis oculi muscle, and it is not only restricted to the eyelid, but also surrounds the orbit. So it has this part of the muscle, the bigger part of the muscle is called the orbital part, while the smaller part that is present in the eyelid is called the palpebral part of the Orbicularis oculi muscle. The palpebral part, the smaller part of the muscle, is considered as the fastest moving muscle in the body, and its contraction will cause closure of the eyelid gently, as in blinking or during sleep. Hence, it is sometimes referred to as the winking muscle. The outer part, or the orbital part of the Orbicularis oculi, on the other hand, causes forceful contraction of the eyelid, and also it causes protrusion of the eyebrows to block out foreign objects or intense light. It should also be mentioned that the muscle is also important in the drainage of tears. When the muscle is inactive, the eyelids, the palpebral part, cannot close to lubricate the eye. In addition, the tears fall out onto the face because the punctum on the lower eyelid, which is the hole that drains the tears, is no longer applied to the eye. Another point about Orbicularis oculi muscle is that it causes wrinkles on the lateral angle or lateral canthus of the eye. Wrinkles in general are usually formed on the skin in a perpendicular direction to the direction of muscle fibers. So in this case, the wrinkles that arise from the lateral angle of the eye, they are spreading radially in that manner, and this is called the crow's foot. The sphincter mechanism of the Orbicularis oculi muscle is opposed by a dilator mechanism. So the dilator mechanism that opposes the palpebral part of Orbicularis oculi is called the Levator palpebri superioris. As the name indicates, the elevator of the upper eyelid, and this muscle is present in the orbit, and it is not shown here since it is not a muscle of facial expression. Regarding the opponent of the orbital part of the Orbicularis oculi muscle, these fibers here belong to a muscle in the scalp, and this is the frontalis of an Occipitofrontalis muscle. The larger muscle is the Occipitofrontalis muscle. The Occipitofrontalis muscle, as you can see here, it has two bellies, and the two bellies of the muscle are separated by an aponeurosis. An aponeurosis is a wide flat tendon. It is not shown here, and because the plastic model only shows the muscle fibers. So there's an aponeurosis here called epicranial aponeurosis or the gallia aponeurotica, and we can see here the two parts or the two bellies of the occipitofrontalis muscle. This is the occipitalis portion of the muscle, and that is attached to the highest nuchal line of the occipital bone, and this is the frontalis belly or the frontal belly of the occipitofrontalis muscles. Even the occipitalis muscle, which is located away from the face, is also supplied by the facial nerve. In fact, it is supplied by the posterior auricular branch of the facial nerve before the facial nerve dips into the substance of the parotid gland to supply the other muscles of facial expression. The function of the occipitalis muscle is to anchor the aponeurosis and move the scalp backwards, which is possible in some individuals. Now, returning to the frontalis, it has vertical fibers, as you can see here, and so they can elevate the eyebrow, as in worrying, or raising the eyebrows, as in surprise. At the same time, they will produce the horizontal wrinkle lines on the forehead. So far about the dilator mechanism of the eye. Now here we can see some other fibers. These slips of muscle fibers are called the Depressor Supercilii, and actually this is a disputed muscle. Only a few anatomy textbooks mention it, while many authorities consider it to be part of the Orbicularis oculi muscle. As the name indicates, the Depressor Supercilii, it depresses the eyebrow. The pyramidal muscle fibers around the midline here belong to the Procerus muscle, or the tall muscle, as the name indicates. The Procerus muscle arises from the bridge of the nose and is inserted into the skin over the lower part of the forehead between the two eyebrows on either side of the midline, the region which is called the glabella. Its fibers merge with those of the frontalis, as you can see here, and the Procerus muscle helps to pull that part of the skin between the eyebrows downwards. It can also contribute to an expression of anger, causing transverse wrinkling of the bridge of the nose. Now, deep to the fibers of the Orbicularis oculi muscle, you can see here, there are a few muscle fibers that are directed laterally and somehow superiorly. I'll show it to you on the other side as well. These are the Corrugator Supercilii muscle, and as the name indicates, it arises from the medial end of the superciliary line on the skull and is inserted to the skin of the medial side of the eyebrow. Hence, it draws the eyebrow downward and medially, producing vertical wrinkles, or the frowning wrinkles, vertical corrugations. Hence the name Corrugator Supercilii that are present in the glabellar region of the forehead. It may be regarded as the principal muscle in the expression of suffering. It also contracts to prevent high sun glare, pulling the eyebrows toward the bridge of the nose, making a roof over the area above the medial corner of the eye to shield the eye from excessively bright sunlight, as similar to the function of the orbital part of the Orbicularis oculi muscle. Now let's move to the mouth. The sphincter mechanism in the mouth is formed by these horizontal muscle fibers that encircle the mouth, and this is called the Orbicularis oris muscle, from the term oral indicating the mouth. It is the sphincter mechanism of the mouth. It will cause closure of the lips as well as protrusion of the lips, as in kissing. Hence, it is called the kissing muscle as well. This sphincter mechanism is opposed by multiple muscles that radiate from the lip, like in a radial manner, like the spokes of a wheel. These radial muscle fibers form the dilator group, and this dilator group includes several muscles. One of these muscles is seen here of the dilator mechanism. It is attached to the zygomatic arch, or the zygomatic bone, and is called the Zygomaticus major muscle. Zygomaticus major muscle. It is the main smiling muscle and is responsible, at the same time, it is responsible for the cheek dimples in some individuals. Medial to it is another Zygomaticus muscle, which is clearly smaller, hence it is called the Zygomaticus minor muscle. And then medial to it is another muscle here, which is called the Levator Labii Superioris muscle. And then more medially, there is another muscle which is called the Levator Labii Superioris Alaeque Nasi, because it has some nasal fibers, as you can see here, as well as the fibers that are attached to the upper lip. Hence, this muscle, the Levator Labii Superioris Alaeque Nasi, widens the nostrils as well as elevates the upper lip at the same time. Now, if we go a little bit deeper, and in this case, I have to remove some of the muscles, you can see that there is another muscle that is attached on one side. It is attached to the maxilla below the infraorbital foramen, and on the other side, it is attached to the angle of the mouth. So this is called the Levator Anguli Oris muscle. That's to say, the elevator of the angle of the mouth. It is clearly deeper than the other muscles. Now I will return back the superficial muscles, the more superficial muscles. Please keep in mind that hyperactivity of the elevator muscles, it can produce what we call the gummy smile in some individuals, where there is an excessive display of the gingiva during smiling. This includes excessive contraction of the Zygomaticus muscles, Zygomaticus major, Zygomaticus minor, Levator Labii Superioris, and Levator Labii Superioris Alaeque Nasi muscle. Now, similar to the upper lip, there is a couple of muscles in the lower lip. So we have this triangular muscle here, which is called the Depressor Anguli Oris muscle, as opposed to Levator Anguli Oris muscle. And we have these vertical or almost vertical muscle fibers, which are called the Depressor Labii Inferioris, as opposed to the Levator Labii Superioris muscle. Now, excessive contraction of the Depressor Anguli Oris muscle can produce what we call marionette lines in some individuals. Near the midline, there are a few slips of muscle fibers called the Mentalis muscle, since they are present in the mental region of the chin. The fibers extend between the mandible and the overlying skin of the chin, and it puckers the skin of the chin, hence it is sometimes referred to as the pouting muscle. It helps protruding and everting the lower lips, as in drinking or in applying lipstick. Together, Mentalis and the Depressor Anguli Oris muscle produce the facial expression of doubt or contempt. The Mentalis also helps the Orbicularis Oris muscle. This is again the Orbicularis, the concentric fibers of the Orbicularis Oris muscle, in cleaning food from the mandibular labial vestibule. The Mentalis muscle may be partially paralyzed as other muscles of facial expression by using botulinum toxin to reduce the cobblestone appearance of the skin of the chin for cosmetic purposes in some individuals. Another muscle of the dilator mechanism of the mouth is deep and is called the Buccinator muscle. This is the Buccinator muscle. I'm going to remove the more superficial muscles in order to show the Buccinator muscle. So this is the Buccinator muscle. Look at the horizontally lying muscle fibers. And these muscle fibers reach a point here near the angle of the mouth, lateral angle of the mouth. This is called the modiolus. And at this point, it is like a chiasma. There's an exchange of fibers. So the upper fibers of the Buccinator muscle will continue with the lower fibers of the Orbicularis Oris muscle, and the lower fibers of the Buccinator continue with the upper fibers of the Orbicularis Oris muscle. The horizontal fibers here posteriorly are attached to a fibrous tissue, a fibrous sling or a ligament, which is called the pterygomandibular raphe. I will show it to you here. You can see here, this is the pterygomandibular raphe, which extends from the medial pterygoid plate, from the pterygoid hamulus of the medial pterygoid plate, down to the mandible at the posterior part of the mylohyoid line of the mandible. The Buccinator muscle is the muscle of the cheek, and it is lined by the mucosa of the mouth, the mucosa that forms the vestibule of the mouth, the part of the mouth that is present between the cheek and the gums. Hence, it aids in mastication, since the muscle compresses the cheeks against the molar teeth, and this is important in pushing the bolus of food from the vestibule of the mouth toward the teeth. The Buccinator muscle is also important for blowing, as in the case of a trumpeter. So that's why the nickname of the muscle is the trumpeter muscle. Also, it is important in sucking, as in newborns, where there's a well-formed pad of fats here, which is called the buccal pad of fat, that acts as an anchorage point for the muscle. Now, reconstructing the muscles, you can see here the few muscle fibers that are present here, the horizontally lying muscle fibers here. These are called the risorius muscle, and they come from the fascia over the masseter and the parotid gland toward the angle of the mouth. The muscle, therefore, it pulls the angle of the mouth laterally, as in smile or a grin. Some textbooks consider this muscle as part of this muscle, which is the upper fibers of the platysma muscle. So the platysma muscle here is another muscle of facial expression that is mainly present in the neck. We are not showing the whole extent of the muscle. On the face, we can see the superior fibers, and they cross the mandible, some being inserted into the bone. Others, they are attached to the skin of the lower part of the face, blending with the muscles about the angle and lower part of the mouth. The muscle, the platysma muscle, as a muscle of facial expression, is also supplied by the facial nerve. This muscle, the platysma muscle, because it's a muscle of the neck to start with, produces a distinctive bowstringing or tenting up effect on either side of the neck. On the face, it also draws down the lower lip and the angle of the mouth, as in frowning. However, the platysma muscle plays only a minor role in depressing the lower lip. The depression of the lower lip is mainly produced by the Depressor Anguli Oris and Depressor Labii Inferioris muscle. Finally, around the nose is the nasalis muscle. It's not shown completely here, but as you can see, it has a transverse part and an alar part. The alar part is not clearly shown, but the transverse part is clearly shown. The transverse part is also of the nasalis is also called the compressor nares muscle, and it arises from the maxilla the fibers proceed as a thin aponeurosis on the bridge of the nose and merge with the fibers of the muscle on the opposite side. Hence, this muscle, the transverse part of nasalis, or what we call compressor nares, as its name indicates, compresses the nasal cartilages. This is a nasal cartilage. It is not the bone. And at the same time, because it's also attached to the skin, it can produce what we call the bunny lines. These are another kind of wrinkle lines, the bunny lines, that appear on the lateral and dorsal aspect of the nose and may extend to the upper eyelids. The alar part, which is the dilator part of the muscle, as I said, is not shown clearly here, but actually it fuses with these few muscle fibers, which you can see them here, the depressor septi nasi muscle. These muscle fibers are attached to the nasal septum and draws the ala of the nose downwards. Okay, so this concludes our study of the muscles of facial expression. Thank you very much.